Hello everyone, my name is Katherine and welcome to my presentation on my vision mission and ways you too can make a difference. First, let me introduce myself. I live in St. Louis, Missouri, USA. I attend John Burroughs School and am a rising senior. Throughout my years at Burroughs, I participated in Model United Nations, becoming a co-leader this year for the MUN Impact Club. I am also a co-leader of the Gender Equity Organization, which runs and supports events throughout the year that help women in our community. Finally, I am a co-leader of the Current Events Club, which strives to foster unbiased discussion of all current events. I am also an active volunteer through an organization called the National Charity League. In today's presentation, I will go over 3 things, leaving time to answer any questions you may have at the end. I will begin talking about Eyecare as a whole through a global health lens. Next, I will discuss my own trip, steps my family and I took to prepare for it, and its lasting impact. Finally, I will discuss how you can make your own global health impact. It is much simpler than you may think. First, a little background information. In healthcare, Eyecare is often overlooked. In many countries, vision tests are not required or conducted during primary health exams. People can go years without being diagnosed with vision loss. Even the World Health Organization's Director General recognizes this as a problem, stating eye conditions and vision impairment are widespread, and far too often they still go untreated. According to the World Health Organization's report on world vision, published for the first time in 2018, approximately 2.2 billion people are affected by vision impairment or blindness. Of those cases, 1 billion could have been easily prevented or have yet to be addressed. This is a clear indication that standardized eye care is lacking in the world. Of that 1 billion, 800 million only need a simple eye exam and eyeglasses in order to fix their visual impairment. Anyone can provide this type of medical care with just a little bit of training through YouTube videos. The lack of standardized quality eye care worldwide has a direct impact on the success of developing economies and societies. Children suffering from vision impairment or loss are less likely to succeed in schools, as they are not able to see the board. Similarly, adults who are unable to see clearly are not able to get high-paying, skilled jobs. When individuals are not able to contribute to the economic development, communities are not able to reach their full potential. Providing eye care is a crucial step in supporting economic and social development. Now that you have learned a little more about the background of global eye care, I will explain how my family and I made a difference through creating our vision mission trip. Everything began the day we met Sonia and Jerry. Sonia is shown in the picture on the slide. These 2 amazing people began a mission on the small island of La Gonâve, Haiti. They built a school, a pediatric clinic, a feeding program from the ground up. They provide medical care and schooling for local children. When we met them, we knew we wanted to help in some way. After a few weeks of brainstorming, my family and I decided to focus on vision for our trip, because all of us would be able to contribute. We also knew how overlooked but important vision is in global health. Thus, we began our preparations for our first trip to La Gonâve. The most important thing, and what made all of this possible, was the fact that no one needs a medical license to give out this type of medical care. Once we confirmed our plans to travel with Sonia and Jerry to La Gonâve, we needed to collect all necessary supplies. We first began with glasses, as we would need to accumulate 1,000 pairs. My brother and I began setting up drives in our respective schools. We also solicited religious organizations, doctors' offices, neighbors, and family friends for more donations. Even with all of this outreach, our main supply of glasses came from large optical companies. This was a huge outbreak, as 400 pairs of free glasses, ranging in prescription, were donated to our cause. Never underestimate what people are willing to give you if they believe in your cause. Once we had collected 1,000 pairs of glasses, we needed to measure them with a lensometer and organize them into gallon Ziploc bags based on prescription. On the right, you can see me in the middle of this process. We were also able to borrow an autorefractor from a local First Baptist church. This point-and-shoot machine allowed us to quickly get an estimate of a person's needed visual correction. While my family and I are not religiously affiliated, churches and other religious organizations are often willing to help with medical trips, as they may have similar programs. Finally, we bought nonverbal games to play with the kids while they waited for eye exams or after the clinic was closed. We wanted to be able to connect with them even though we did not speak Creole. We also bought Dum Dum suckers and other non-perishable treats to give all patients after their exams were completed. After months of preparation, we were finally able to travel to Glohea. When we arrived, we immediately began setting up our clinic. On opposite walls, we duct taped eye charts and placed a piece of duct tape on the ground 10 feet away to indicate where to stand. As you can see on the picture on the right, we placed all of the bags of glasses on the counter organized by prescription. Next, we found a dark room for conducting autorefractor screenings. Finally, we hired 2 interpreters to help us communicate with patients. Once our clinic was set up, we opened for patients every day from 8 to 12 and 2 to 6. During that time, we saw people of all ages, ranging from young school children to elderly adults. We screened every patient that entered the clinic. If the preliminary eye exam using the eye chart indicated they needed glasses, I would take them for their autorefraction. After that, we would give them a manual refraction as well to confirm the necessary amount of correction. Manual refraction is a very simple process that can be learned through videos on YouTube. After the manual refraction, my brother and I would search for a pair of glasses closest to the prescription. Finally, we let each person read the eye chart with their new pair of glasses to ensure it improved visual acuity. Each day, we saw approximately 100 patients. After 7 days, we had met and helped 694 people. Because we helped so many people, we knew we had to continue the trip. We have made 5 trips back to Glohea over 5 years. Now on to how you too can make a difference. The first and most important step is to find your inspiration. Your passion will drive you and ensure your success. You have to look outside of your daily life in order to find something that piques your interest. My advice would be to look for things that do not require a medical degree. That way, you can immediately begin to help others. This could include creating drives to collect toothpaste and toothbrushes, diapers, and menstrual products to either help those in need locally or internationally. Another way to help is to raise money to buy a hand pump for clean water, as most developing communities do not have access to many reliable sources of water. These are just some examples, but the bottom line is find projects that support global health and involve people of all ages. Once you have found your passion, begin taking action steps. The first and easiest of these steps is awareness. People will only act on an issue if they understand it. The second step is to start a community or school drive to support a local or international organization. This is a great way to begin working in global health. Finally, if you feel incredibly inspired, you can begin your own trip or organization. Communities around the world need your help. The most important part of our vision mission idea was that nothing we did required a medical degree. Anyone could get involved and help. For me, this vision mission trip was an ideal way to get involved in global health. It opened my eyes to how many people around the world do not receive proper eye care. I know that I am making a difference in helping communities grow. Looking back, I realized that it is easier to get involved in a mission trip than I originally thought. There are people that are willing to support your cause and help you along the way. Finally, my trips to Haiti have had an incredible influence on my life and the way I view the world. It has made me understand how many things I take for granted. I also know that I want to help people in some capacity for the rest of my life. Looking forward, my family and I plan to return to Haiti as soon as the threat of COVID-19 is reduced. I have found my passion and a great way to pursue it while also supporting global health, and I hope that you are able to do the same. Thank you so much for listening, and I hope that you learned something and feel inspired to pursue a passion of your own.